Heart disease is a serious global issue. The good news is that many of its risk factors are within our control. Whether you're looking to maintain a healthy heart or support a loved one's cardiovascular health, these 10 essential tips will provide valuable insights and actionable steps to keep your heart strong and thriving. Join us as we explore the key strategies for promoting heart health and reducing the risk of heart disease. Stick around till the end because you might be surprised by some of the simple and easy ways we'll cover. Number 1. Keep your blood pressure under control. One of the key ways to maintain heart health is by keeping your blood pressure under control. High blood pressure, also known as hypertension, is often a silent condition that shows no symptoms. Regular blood pressure checks, at least once a year for most adults and more frequently for those with hypertension, are crucial in detecting and monitoring this condition. To lower blood pressure, lifestyle changes play a significant role. Adopting a healthy diet that is low in sodium and high in fruits, vegetables, whole grains, and lean proteins can have a positive impact on blood pressure. Regular exercise, such as aerobic activities and strength training, can also help reduce blood pressure. In some cases, lifestyle modifications may not be enough, and medication prescribed by a doctor may be necessary to effectively manage high blood pressure. It's important to follow medical advice and take prescribed medications as directed. Number 2. Keep your cholesterol levels under control. Taking control of your cholesterol levels is crucial for maintaining a healthy heart and reducing the risk of coronary artery disease and heart attacks. When cholesterol and triglyceride levels in the blood are high, they can lead to the formation of blockages in the arteries. To keep cholesterol levels under control, lifestyle changes are key. A healthy diet plays a significant role. Choosing foods low in saturated and trans fats and high in soluble fiber, such as fruits, vegetables, whole grains, and legumes, can help bring cholesterol back to normal levels. It's important to limit foods that are rich in cholesterol, like fatty meats and full-fat dairy products. Number 3. Take a daily walk. Taking a daily walk is a proven method to improve cardiovascular health and reduce the risk of heart disease. Research spanning several decades has consistently shown that engaging in regular cardiovascular exercise is crucial in protecting the heart. Walking is an effortless and accessible form of cardio that can be done virtually anywhere, both outdoors and indoors on a treadmill. Scientific studies suggest that despite its lower intensity compared to activities like hiking, jogging, or cycling, walking can still effectively lower the risk of heart disease. Walking is an excellent activity for our heart as it provides numerous benefits. It improves cardiovascular health by strengthening the heart muscle, increasing blood circulation, and reducing the risk of heart disease. Walking helps raise levels of good cholesterol and lower blood pressure, promoting a healthier heart. Additionally, it aids in weight management, reduces stress, enhances oxygen delivery to the heart, and lowers the risk of chronic diseases. Before we proceed to the next essential tips to reduce the risk of heart disease, be sure to hit the subscribe button. Number 4. Manage diabetes. Proactively managing diabetes is vital, as it is concomitantly tied to an increased risk of heart disease. Due to prolonged exposure to high blood sugar levels, the blood vessels and nerves that regulate heart and blood vessel function can become damaged. Regular diabetes screenings, ideally every 3 years after reaching 45 years of age, are essential. However, your doctor may advise screenings at an earlier age or with greater frequency, depending on your individual risk factors. If you have diabetes, it is crucial to diligently monitor and control your blood glucose levels. By doing so, you can help mitigate the potential complications associated with diabetes and lower your risk of heart-related issues. Number 5. Limit alcohol consumption. It is essential to be mindful of alcohol consumption to maintain heart health. Excessive alcohol intake can lead to weight gain and elevated blood pressure, increasing the risk of heart disease. To mitigate these risks, moderation is key when it comes to alcohol consumption. For men, it is recommended to limit intake to a maximum of 2 alcoholic beverages per day. Women, on the other hand, should aim for no more than 1 alcoholic beverage per day. By setting these boundaries, individuals can better manage their alcohol intake and minimize the potential negative effects on heart health. Number 6. Quit smoking. Another great way to reduce the risk of developing heart disease is by quitting smoking. It's widely known that smoking poses serious health risks, including cardiovascular diseases like heart attacks and strokes. Smoking is a major risk factor for heart disease, with smokers being 2 to 4 times more likely to develop heart disease than non-smokers. The chemicals in cigarette smoke and exposure to secondhand smoke can increase blood pressure, making individuals more susceptible to heart attack or stroke. Smoking negatively impacts your cardiovascular system by promoting the buildup of plaque in your arteries, changing your blood chemistry and thickness, and causing permanent damage to your heart muscle and blood vessels. According to the National Heart, Lung, and Blood Institute, even sporadic cigarette indulgence can inflict considerable damage. By taking the proactive step of quitting smoking, you can greatly enhance your overall cardiovascular health and significantly reduce the associated risk. It's a worthwhile endeavor that can have a profound impact on your well-being. Number 7. Manage stress. Properly managing stress is crucial for maintaining a healthy heart. Stress has been closely associated with heart disease as it can elevate blood pressure, a known risk factor. Moreover, extreme stress can even act as a trigger for heart attacks. Additionally, typical coping mechanisms like overeating, excessive alcohol consumption, and smoking, often used to combat stress, actually increase the likelihood of heart disease. To effectively manage stress, it is advisable to incorporate practices such as meditation, regular exercise, and adopting a healthy lifestyle. Don't hesitate to seek support from a mental health professional. They can provide guidance and additional tools to help you navigate stress and enhance your overall heart health. Number 8. Get enough sleep. Lack of sleep can increase the risk of heart disease as it is associated with high blood pressure, diabetes, and obesity. Most adults should aim for 7 to 9 hours of sleep every night. It's not just about the duration, but also the quality of sleep. Establishing good sleep habits is important. If you often wake up during the night or have trouble breathing while sleeping, it's advisable to speak with a healthcare provider. You could be experiencing obstructive sleep apnea, which can disrupt breathing and hinder your ability to have a restful sleep. Untreated sleep apnea can increase the risk of heart disease. Your doctor may recommend a sleep study to diagnose the condition and provide appropriate treatment if needed. Number 9. Maintain a healthy weight. Maintaining a healthy weight is essential for reducing the risk of heart disease. Being overweight or obese can increase your chances of having high blood pressure, high blood cholesterol, high triglyceride levels, and diabetes, all of which can have a serious impact on your heart health. By observing a BMI of 25 to 30, an individual is considered overweight, and having a BMI over 30 indicates obesity. If you are found to be carrying around excess weight, losing it would significantly reduce your risk of heart disease by minimizing its risk factors. By proactively managing your weight, you can enhance your heart health, lower your risk of obesity-associated health issues, and contribute to long-term wellness. Number 10. Eat a heart-healthy diet. Eating a heart-healthy diet rich in nutrient-dense foods such as vegetables, fruits, whole grains, lean proteins, low-fat dairy products, nuts, and healthy fats is crucial to maintain cardiovascular well-being. Moreover, it is essential to limit saturated and trans fats, full-fat dairy products, fatty meats, fried food, foods high in sodium, and added sugars, which can increase the risk of coronary heart disease. Opting for a heart-healthy diet like the DASH or Mediterranean eating plan can improve cholesterol levels, reduce blood pressure, and mitigate the risk of heart disease. These wholesome diets have proven to be effective in providing essential nutrients to the body while keeping your heart healthy, making it a win-win choice for long-term health goals. So be conscious of what you eat and make heart-healthy eating a priority in your life. Thank you for watching, and make sure to watch more amazing videos from our channel.